Speaking more about the federal legislations, there have been a number that have been introduced to the House. I was wondering if you could comment on them, particularly the ones about the pro-women's healthcare centers, and the House Resolution 722, which hopes to implement equal protection under the Fourth Amendment of the Constitution to the right of life for born and preborn human people.
So I will admit I am not so good at like specific legislation and numbers. So what was the first one?
Yeah, so the first one, it's House Resolution 7.
Oh, house. Okay.
Yeah, it has language about how healthcare for women should also address the needs of men, families, and communities as they relate
Mhm.
to women's healthcare. And they also mention something called the Pro Women's Healthcare Centers, which has certified healthcare centers nationwide that meets its standards for high quality life affirming care.
Okay. So I think so I'm not a lawyer. And so this is one of the things that I fully embrace is that like I know what I know and then there are people who know what they know and it's good to meet those people so you can work together so they can help explain things like your five and then figure out okay, how does this apply to what I know? So what I say about these things is not like the end all be all, but my understanding of the House Resolution 7 is that that's the one that's trying to block like federal funds for abortion, I think. And by cutting off financial support from anything federal to anything that could be conceived as relating to abortion, that's a way to just reduce access, make barriers greater, make things more expensive for people who already can't afford care. And like everything, this is the attack on abortion and reproductive health care is like there have been some monumental fundamental changes that have been catastrophic, such as the Dobbs decision. But then everything else is like death by a thousand cuts. And so I think this is part of that strategy of just they're just throwing everything there to see how they can over time make it harder and harder and harder for people to get access to care. So that's my really superficial and probably not totally 100% um, accurate understanding of House Resolution 7. And then the centers, are those like crisis pregnancy centers that you're referring to?
Yeah, it appears based on the phrasing of the resolution that they want to legitimize them more and
Oh.
have set standards that are separate from ACOG,
Ugh.
which is, yeah,
Ugh,
definitely a
terrible.
terrifying concept.
Terrifying. So those places are awful. And in Ohio, like we already so much of our taxpayer money goes to pay for crisis pregnancy centers to exist. And all they do is make people feel bad, indoctrinate them into things that are false, delay care. Um, they misrepresent themselves, and people will go to those crisis pregnancy centers, which are run by anti-choice people entities, thinking that they're going to get reproductive health care because a lot of those places really do seem like medical facilities, but they're not. Um, and that's dangerous. And the fact that our taxpayer money goes to fund those is appalling. So I imagine that by trying to set these standards, they're just trying to like legitimize them more, which is terrible.